Mathematical models of infectious disease dynamics have a long history, and they continue to mature with ongoing advances in computational tools and access to disease incidence data. They provide an important tool for understanding disease dynamics, evaluating potential control strategies, and predicting future outbreaks. Also, they can be used during an ongoing outbreak. The models can project how infectious diseases will progress to show the likely outcome of the epidemic and accordingly help inform public health interventions. Well, the models we have available so far allow us to investigate various interventions and their relative impacts on flattening the curve of the COVID-19 epidemic in the country. For example, they can give us qualitative warnings about the possible dangers of lifting interventions too early or keeping them on for a long time and risking a second wave of infections afterwards. This can also show us to what extent the health systems will be burdened by such measures. Well, models in general run on assumptions, and those assumptions change as new data becomes available. Since COVID-19 is still a new virus, there are important things we still don't know about it, which makes simulating its spread particularly challenging. As models mature over time, with the emergence of new data, their projections will also keep changing and maturing accordingly. With every addition of new evidence, the model becomes more complex and moves a step closer to simulating reality. But we are still far from that with COVID-19. They try to, but these predictions are based on assumptions that need to be taken into consideration and should be compared across multiple, equally plausible scenarios. Still, models are not magic crystal balls that can predict future numbers. They are just one of many tools that can be used by decision makers, all of which rely on the collection and analysis of high-quality epidemiological data. You can think of them as weather forecasts, which simulate a projection based on past experience and present determinants. WHO is working with an international network of universities, agencies, and institutes to develop models and discuss their adaptation for the region and its countries. For example, we currently have a collaboration with the COVID-19 International Modeling Consortium, also known as COMO, initiated by the University of Oxford in the UK. We support countries in their use of models and help them understand their benefits and their limitations. In countries that already have capacities to develop national models, we provide technical support to review their model schemas and assumptions. We also help them interpret their outputs and cross-validate the results against ones produced by other models. This includes the use of forecasting tools that try to estimate quantities and costs of essential supplies and health workforce. The bottom line is, decision-making should rely mainly on collection and interpretation of high-quality epidemiological data. Models can guide decisions, but not dictate them.